this virtual conference. Thank you for that. This morning's session is sponsored by C&S Companies. Thank you for that. Our friend Nick McLaughlin from C&S Companies is also a co-chair of our corporate committee. So as you can see, there's many people helping us, but you start to hear the same names and the same companies because the chapter is a tight-knit family. We appreciate all of you for helping us out with this. So session 2, a clean start, pandemic mitigation strategies for airports. Before I introduce your moderators, just a quick shout out to the conference committee. We worked hard to build a conference for Burlington and then tear it all apart and then build a virtual conference for this week and for next week. So thank you, everyone who's on the conference committee. Give a quick wave, because if I tried to memorize all your names, I'm going to forget. But I know 2 members who are, because they're moderating today's session. A special thank you to Susan Cook from NV5, who's one of the moderators today, and Paul McDonough from McFarland Johnson. So with that, thank you all for coming back and for attending. I'm going to turn it over to Susan and Paul. Just a quick reminder before I do that, use the chat function for asking questions during this session, and we've carved out time at the end of the session for an open Q&A. But if you've got questions that you want to ask, I'll spend the rest of this session monitoring the chat and forcing that forward to everyone. Susan, Paul, thank you very much for moderating and developing this session. Go ahead, it's all yours.
Thank you, Carl. Welcome, everyone. I'm Susan Cook from NV5, and I'm proud to be able to present to you Lisa Kay. She is our Chief Operating Officer of the Environmental Health Sciences vertical at NV5. A team of environmental health and safety consultants with a mission of delivering solutions and improving lives through engineering, consulting, and to agencies and companies across the globe. And with that, I'll turn it over to Paul, who is with McFarland Johnson, and he will introduce his speakers.
Thank you, Susan. Again, my name is Paul McDonough. I'm Regional Director of Business Development for McFarland Johnson, located in New England. It's my pleasure today to introduce the other 2 presenters. We've got Chris Kopec, also from McFarland Johnson, who is a LEED certified professional mechanical engineer with more than 24 years of experience in strategic HVAC solutions for airports, medical, institutional, and other commercial facilities. Chris is McFarland Johnson's COVID mitigation strategist. He's responsible for educating MJ staff and for providing guidance and support to airports for fast-track pandemic mitigation improvements. Also with us today is Jonathon McCredie. He's a registered architect, co-founder, and managing principal of Fennick McCredie Architecture. Jonathon has over 25 years of experience leading a wide range of project types, specializing in aviation architecture. Jonathon received his Bachelor's of Architecture degree from Cornell University. And in order to get right into the program, I am going to turn it back over to Lisa Kay of NV5. Thank you.
Thank you, and welcome, everyone. I am going to share my screen. Just a really quick piece of housekeeping. If you're participating and the Zoom chat ends up blocking your screen, you can take that and drag it off to the right side of your screen so you can see my slides. So this morning, let's see if I can get my slides to move. Okay, well, here we go. Last week in my inbox, my email inbox, was an article from Chief Executive Magazine talking about a new reality and something that we're all facing here. We have, as of the end of July, more than 460 employment, labor, and other lawsuits related to the coronavirus. So some of the key things that everyone can do who runs a facility is make sure that you consult with industrial hygiene experts on issues around safety and ventilation. Engage your employees, create and document create and document a detailed plan, including your OSHA controls, and make sure you document every single thing you're doing. CDC and OSHA guidance both require you to create a plan. The OSHA guidance requires a COVID-19 health and safety plan, CDC guidance, and infectious disease preparedness and response plan. And both of these can be the same document. As you engage in planning and continue to revise your plan as more information comes to light, make sure you involve your employees. Implement flexible and supportive policies. And a lot of our clients that we've been advising have found a great use of questionnaires and health checks, because a lot of times, as we all know, we have people who are asymptomatic that may have been exposed that could put everyone in your facility at risk. And then develop and implement a communication plan to include your stakeholders. And of course, document and communicate. That's incredibly important. There's such a thing as communication overload. So really be cognizant about how much communication you're doing. I don't know about you, but I do know when I go into facilities, there are now so many signs, you almost become immune or blind to reading them. So really think and be thoughtful about the signage you use and the communication messages you're displaying. Some of the hazards associated with the virus include aerosols and droplets suspended in the air, persistence on surfaces called fomites, and then there's a lot of science around how long the coronavirus might be active on surfaces. The virus is actually alive, it's just active or deactivated. And then hazards of cleaning chemicals. They can be irritants, they can be corrosives, they can have short and long-term health effects. And then you've got airborne pathogens and just your normal environmental health and safety concerns as a facility manager to be aware of. OSHA identifies levels of risk in which you need to categorize your employees. People who have very minimal contact with the public, for example, me right now, sitting in my home office, I'm pretty low exposure of risk in the workplace environment. Workers that are interacting regularly with others, the public or coworkers, they're considered a medium exposure risk. And then high and very high, those exposure risk categories are for medical transport workers, healthcare, delivery, support staff, morgue workers, healthcare workers. So probably not some that you have, but you do need to worry about the medium and low risks, mostly the medium for your concerns in terms of planning and prioritizing your controls. OSHA sets up a hierarchy of controls. Obviously, a virus isn't a hazard you can eliminate or replace, so you have to determine how you're going to protect people in the environment in which they're involved and working and active. So isolating people from the hazard or engineering controls, things like plastic dividers, things like HVAC system modifications, and administrative controls are changing the way people work. For example, working from home, or working socially distancing, and then personal protective equipment. So when you think about your facility and what you need to do and how you need to continue as more information continues to evolve and different regions continue to change the requirements, you've got to constantly reassess your risk areas. Social distancing, engineering solutions, and I know some of our clients have had challenges associated with the engineering solution. So, I mean, this is an example that I actually saw in a convenience store, and this, I've seen this a couple places now. Good idea, you've got people separated, 6 feet in line, but not 6 feet apart. And so other situations similar that we've seen and advised our clients around have to do with plexiglass dividers. Thinking about, it's great if you put one in place, but make sure that you don't have openings. One example, a store had an opening right at face level so that the credit card reader could be placed there. Well, you're not going to separate the cashier and the customer with a plexiglass divider that has an opening right at face level. So really be thoughtful and mindful about how you're implementing your engineering controls. Staggered shifts are always a good idea if you can make them happen, and then dividing workspaces. Other administrative controls include phasing employees' return to work where you can, making sure you maintain good cleaning schedules, enforcing those social distancing guidelines, and limiting access to areas. And I mentioned before the engineering controls, including high efficiency air filters, increasing ventilation, and physical barriers. So as you walk through your facility, both the front where your passengers are and your back offices and your maintenance areas, and you continue to think about it, think about the nature of the work that individuals do, their exposure to coworkers, and their exposure to the public. Bathrooms, break rooms, locker rooms, places that are small, enclosed, shared spaces are obviously a place of concern and something to think about, because when we talk about exposure to the virus, if you have somebody who's asymptomatic and they sneeze and cough in a small enclosed space, the viral load in that space may be large enough to cause infection to others who are in that space. And as we know, the virus may persist on surfaces, but more and more evidence is coming to light that we really don't understand whether or not people are obtaining the virus from fomite transfer. However, other coronaviruses have been transmitted this way, so it's still really important to have a high level cleaning schedule and being very diligent about cleaning. More and more though, people are thinking about that aerosol transmission and breathing in the virus. In terms of cleaning, develop written cleaning protocols for all your high-touch surfaces. Think about maybe having a one-time third-party validation, something that can document your cleaning protocols are actually compliant with CDC guidelines. Make sure you have a good training program for all your cleaning staff, and then document that they've been trained. Routine maintenance in this new environment is not just taking out the trash, vacuuming, dusting. It's really cleaning those edges and surfaces you wouldn't think about. For example, in the middle and to the far right, cleaning, the entire surface of something that somebody might be touching is really important now. And it's expensive. You have to focus on touchable surfaces, and you have to upgrade your equipment, make sure you have the right PPE, train people, and keep records. These photos are actual work that we've been observing. We do third-party validation. So that picture on the far left, not quite sure what that guy's doing. He's cleaning really high. Probably unlikely that that's an area of concern. You need to be cleaning the areas that people are coming in contact with, those high-touch surfaces. Middle photo, great. It's really important that when you use a cleaning material on a hard surface, the cleaning agent is allowed to be wet and stay on that surface for the length of time that is required by the product itself. It's called dwell time, and it's listed on every single product. And then things you wouldn't think about, like pens and other surfaces people are touching. As I mentioned, you got to focus on EPA dwell time. There's an EPA website that tells you for each particular product associated with viral pathogens and human coronavirus, how long, what the contact time, the amount of time that material must be wet with the product for it to be effective. Here's a particular project that we were working on and some lessons learned. So we provide environmental health and safety management support at a international airport in California. And so there's a lot of lessons that we learned associated with early coronavirus issues that as they phase back into work. So their admin building is separate from the other, and they wanted to limit entry and make sure they only had a certain number of people in the building at any one time. They hired a security guard and they put him at the front door. People could only enter the building with appointment. They were doing temperature checks and questionnaires, documenting who came in, when they came in, and what office they were from, and then mandatory hand sanitizer as you entered the building. They took their essential staff and staggered their working days. With the maintenance crews, they held all safety meetings outdoors with 6-foot spacing, and then they put plexiglass at the front desk. In the terminals, the airport employees, as people started getting used to early in the pandemic, people weren't really accustomed to 6-foot spacing. So they had an employee to regulate escalator and elevator entry to make sure people didn't pack their way onto escalators or elevators. They also put intervals marked in checkpoints. They managed the line wrap and made sure employees had appropriate and available PPE. Some of the lessons learned from this experience, the employees were clocking in and clocking out, and there were issues associated with that. People were really concerned about getting their time logged right. And so if there was long queues in the clock in and clock out line, and no cleaning between each person's use of the time clock. And employees were complaining about being late and having to get there early because of the social distancing. So they had to work on resolving that issue. Additionally, there were attempts to bypass admin security guard. Signage was ignored by passengers without that human enforcement and regulation. As I said, we've all become a little blind to signs. And then really to reinforce it, top-down participation was required for airport management to consistently wear masks. The maintenance crew originally didn't really do it. It's hot outside, they're working. And so the CEO and airport management really stuck to their guns about that requirement. As you think about engineering controls and managing your HVAC, or maybe you've closed down a part of your facility and you're thinking about reopening, really think about the law of unintended consequences. So for example, if you increase humidity and other engineering controls, you might have mold growth. If you've closed down a facility or you've stopped running water and pipes, you could have Legionella. We've been finding some cases of Legionella in a number of facilities, not necessarily airport facilities, but buildings that have been shut down and are now reopening. So really important, flush those out, make sure you investigate and are prepared to reopen when you've shut something down. Identify all the risks associated with those systems. Practice self-monitoring and thoroughly understand those preventative maintenance requirements. So if you're going to remove filters or clean, really have a plan in place and document the process and procedures you're going to use. Check for dry traps, exercise your plumbing, and before you open a building or a facility, probably a good idea is a mini retro commissioning so you've got your set points proper. And if you have any health concerns, figure out how you're going to isolate a part of a building. So let's talk for a minute about airborne pathogens. It is becoming increasingly concerning that the virus is likely transferred through airborne exposure. And so changing in ventilation of your building can help reduce those airborne exposures. And our next speaker is going to speak quite a bit about that. It's easier said than done, given the complexity, urgency, and evolving understanding of the risk presented by this virus and the aerosols. And one of the challenges is that there aren't diagnostic tools to adequately approximate the mobility of a virus in a facility. We've recently partnered with a technology company that developed a technology that was born out of bioterrorism. They have a safe DNA, and we've been utilizing it with them in conducting surveys for pathogen mobility. Gives us a quantitative way to determine how a virus will move through a building. It's great. For example, we've used it most recently in a study at a prison in California. This prison is it's a hotbed for coronavirus. A third of the inmates are positive. Many of the staff have been ill and several have passed away, unfortunately. So the prison wanted to set up a remote medical center within the facility in a separate building, 60,000 square foot building. And so we did a survey risk assessment to identify hotspots and make sure the safe zones were in fact safe by deploying the safe DNA in concentrations. And then we were able to create heat maps and test where it went and give advice to the state of California around changes that they could make. This tool is really a great diagnostic for those small enclosed spaces, rooms where there's a lot of people, so you can detect how long it takes for a room to recover after a high concentration, say a sneeze or a cough of the viral load, how long it takes to recover. And you can then make decisions about space utilization, your HVAC settings, your filtration, and other disinfecting solutions. It's also a great diagnostic for your settings, your HVAC settings, to know, are these the right settings? You can do before and after, and it's also fantastic for filtration diagnostics. It's just a new tool in the toolbox, but it's something that we're pretty excited about. And at this point, I'll pass it on to Chris.
All right, can everyone see my my presentation? Yeah, okay, great. So thank you, Lisa, and thank you for those in attendance at today's presentation. Today we're going to concentrate on practical HVAC strategies for helping us deal with this pandemic. So the presentation is going to be broken into 3 categories. We'll have a brief overview of the suspected transmission methods of COVID-19, the role of HVAC systems and strategies proven effective in interrupting disease transmission. And we'll end with things you can literally do today to make your building safer for airport staff and returning passengers. So full disclosure, I'm a mechanical engineer and not an epidemiologist. But the information I'm going to share today, it's based on the latest guidance available from the leading agencies in the scientific community, such as the CDC and the WHO, in addition to the leading HVAC technical research organizations such as ASHRAE. I thought it'd be worthwhile to begin by spending just a minute on what we know about COVID-19. So we'll begin with how COVID-19 is thought to spread. As Lisa has already touched upon, according to the CDC, it may be possible to get COVID-19 by touching a surface or object that has a virus on it, and then touching your mouth, your nose, your eyes. While the virus can survive on surfaces for some length of time, as evidence on COVID-19 transmission has matured, scientists don't believe this is the primary way the virus spreads. And to minimize the possibility of contracting the virus through surface transmission, we all know about the hand washing recommendations, with 20 seconds of suggested washing time. The virus is thought to be spread primarily between people who are in close contact with each other within 6 feet. It spreads through respiratory droplets produced when an infected person coughs or sneezes or talks. The droplets can land on nearby surfaces, contributing back to that surface transmission we talked about. They can fall in the mouths and noses of other people who are nearby, or may be inhaled in the lungs. Wearing a mask while in public, in combination with good social distance practicing, reduces your risk of contracting the virus. So of note, there's not a magical wall at 6 feet distance that stops the virus. It's a rule that's based on the typical carry distance of organic droplets. It doesn't consider aerosolized particles, which stay airborne and travel for much greater distances. So what's meant by close contact? CDC calls it as basically a prolonged period of time spent within 6 feet or within a room of an individual who's been positively diagnosed or who is asymptomatic, or direct contact with infectious secretions. So think of this as sharing utensils, hugging or kissing somebody who is positive as close contact. It does not include activities such as, hey, I walked by somebody down the hall, or briefly sitting across from somebody in a waiting room or an office. I try to think of this as like a contact time density, if you will. How many people are there? How long are you there? And how close are you to other people? You're indoors versus outdoors, etc. So it's not known to be transmitted through food, your water supply, or generally speaking, the Amazon delivery that's on your front porch. So that's all I wanted to touch upon regarding the virus itself. The rest of the presentation is going to concentrate on practical HVAC strategies that have been proven to be effective in reducing the transmission of the disease. There's a lot of different strategies out there. I can't possibly cover all of them in the brief time I have with you today. So I've concentrated on some of the more proven strategies and technologies you can implement in your building systems. Doesn't mean the other methodologies don't work or do work. It just means I'll be concentrating on areas that have little debate in the engineering world. So knowing that employments are where they are and capital improvement budgets could be tight, I've focused on mature strategies that don't necessarily require a huge investment up front. They're easily reversible such that when we get to the other side of this thing, and we will get to the other side of this thing, you have the option to continue with these healthy building strategies or revert back to your pre-pandemic benchmarks. So before we talk about airports, I thought it'd be helpful to talk briefly about what hospitals and healthcare facilities do. So borrowing from my time designing HVAC systems for hospitals, one of the requirements we need to address with the HVAC design was pressurization relationships between adjacent spaces. So basically, certain rooms within a healthcare facility should be positively or negatively pressurized with respect to their adjacent areas. Positively pressurized spaces usually designed to protect the patient, clean supplies or equipment, while negative pressure is typically used to contain an airborne contaminant within a given space. So, for example, you'll have patient rooms, operating rooms, etc., that are positively pressurized, and restrooms, janitor closets, emergency room waiting areas that would be negatively pressurized. So at this point, Paul's probably thinking, why is this guy talking about hospitals at an airport conference? Well, that's a great question, Paul. So if we take a closer look at the typical airport hold room, you'll see that maybe it's not so different than an emergency room waiting area. They both have the potential to see a large number of people from diverse backgrounds, potentially waiting a long time in an enclosed, tight indoor space. So some of the passengers could be asymptomatic, some could have mild symptoms and just assume it's a common cold or their allergies. And perhaps some of the passengers may not be following the airport's mask policy as well as they could be. So I recommend airports consider creating either a negatively pressurized hold room or a negatively pressurized area of their hold room that sees the most use. So this is a proven strategy that will help reduce the likelihood of pathogens from being recirculated into the other parts of your terminal, and it'll help lower the risk of transmission to airport personnel, TSA, ticketing, ground transportation, etc. The hold room, it has the greatest potential for that CDC's close contact. So we're trying to ensure that contaminants are contained and filtered or exhausted out of the building so as not to compromise the other parts of the terminal. So I'll pull up a quick example here. We have a small to medium-sized hold room. This particular hold room has approximately 6 gates. So if we added a couple of exhaust fans here, centrally located, once energized, the exhaust fans would remove the potentially contaminated air from the hold room, keeping the space under a slightly negative pressure, and primarily draw air from the terminal itself, which essentially contains this area from an airflow perspective. Next up is filtration. Increasing the filtration efficiency in your equipment has also been proven to be an effective transmission strategy. So I got to give you a crash course in filters here. So we'll start with MERV. Filters are measured in MERV. It stands for minimum efficiency reporting value. Basically, it goes from a MERV of 1, which is a very low efficiency filter, to a MERV of 16, which is one of the higher efficiency filters. The industry offers even more efficient filters, and for continuity with the ASHRAE rating system that was established, they refer to these high efficiency filters as like MERV 17 through 20, basically for medical use, clean room applications, and so on. So my intent isn't to go over this this chart in any great detail, just to make you aware of it. And if you're curious about the details, I can happily send you a copy of this, or just do a web search for MERV rating chart. So next up is filter particle size. It's measured in microns, as displayed over on the other side of the screen here graphically. So for some perspective, a grain of salt is approximately 100 microns. Typical human hair is 50 to 70. 40, as displayed graphically here, is about the human eye visibility limit. And the COVID-19 virus is that little red dot way down there. So it's quite a bit smaller than most things. So you may hear talk of HEPA filters, and what's a HEPA filter? It's just it's a highly efficient filter with an unofficial MERV rating greater than that MERV 16. And finally, COVID transmission is believed to require a carrier particle. In other words, there aren't just rogue COVID particles floating around in space. They typically attach to what's known as a carrier particle, consisting of water or mucus or other biological materials. That gets them a little bit heavier and typically to 1 micron size or greater in size. So that helps with your HVAC system's filter capabilities. So what's the best MERV rating for your equipment? HEPA filter sounds pretty good, so why don't we just add HEPA filters to all our equipment? Well, it doesn't really work that way. So your building's central air handling equipment is going to have the greatest potential to take advantage of the filter upgrade. The internal fans are more powerful and can handle more efficient filters, and they're much better than the smaller decentralized equipment that requires filters. This is because increased filter efficiency generally requires an increased pressure drop through the filter. So in simple terms, a pressure drop is basically air resistance. Your air filter is a literal barrier between your HVAC system and the remainder of the air distribution system, and it slows the ability of the air to get pulled or pushed through the ductwork of your system. So how much your HVAC's airflow is slowed by a filter is directly related to its pressure drop. And pressure drop will vary by filters. Filters that are more tightly woven and typically more efficient make it harder for air to pass through them. This is going to create a decrease in the airflow and a higher pressure drop. So what I recommend, you want to find that balance to ensure your HVAC system can handle filter upgrades without negative impacts to pressure differentials or airflow rates prior to changing your filters. Break out your equipment O&M manuals to see if the manufacturer offers a suggested maximum filter efficiency. The physical size of your equipment's filter racks will also provide some limitation to the type of filter you can upgrade to. ASHRAE recommends a MERV 13 or higher filter whenever possible. Cost, general rule of thumb is assuming your HVAC is served by standard efficiency filters today, your cost for filters is probably going to double when you make the move to the higher efficiency filters. So other things you want to consider for your maintenance staff, with COVID-19 having the potential to be airborne, these airborne particles are eventually going to find themselves in your HVAC system and hopefully caught by your equipment's filter section. So a couple things. You might be thinking you should increase the frequency of the filter changes. Actually, ASHRAE recommends quite the opposite, reducing the frequency of the filter changes if possible. So this is going to reduce the exposure of maintenance personnel to the potential contaminants, as well as reduce the risk of these particles being reintroduced back into the building. So when replacing filters, maintenance personnel should wear appropriate PPE, respiratory and N95 or higher if possible, wear eye protection, disposable gloves and coveralls, and when feasible, filters can be disinfected with just a mild bleach solution, say a 10% solution or so. Filters, whether they're disinfected or not, can be bagged and disposed of in regular trash. It's just about out of an abundance of caution with PPE. And when maintenance tasks are complete, maintenance personnel should immediately wash their hands with soap and water or use some kind of hand sanitizer. Next up is the use of ultraviolet light. It's another proven mitigation strategy. So what exactly is it? And I'm not going to get into a physics lesson here, but it's a high frequency light visible to the human eye, broken into 3 bands. UVA is kind of like black lights and tanning beds. UVB is what we've all experienced in that summer sun. It's typically the primary source of sunburns. And UVC light, which UVC seems to be the best at microbial inactivation. So a bit of history on it. It's been around quite a while. It's been consistently recommended and used in hospital central HVAC equipment for at least the last 35 or 40 years. You notice there was a study that came out in May of this year out of Oxford, and they simulated sunlight using UV lighting, and it was shown to rapidly inactivate COVID-19 particles. Basically, they simulated the summer sun, and the virus, 90% of the virus was inactivated within 7 minutes. What's really encouraging about this study is it provides the first evidence that sunlight may rapidly inactivate COVID-19 on surfaces. So the effectiveness is based on dosage, the intensity and duration of the exposure. So where do we typically use these UV lights? So they're going to be in your duct air disinfection to treat air as it passes by inside your air handling equipment, typically treating the cooling coil section inside your equipment. Upper air disinfection, this essentially looks like a ductless split wall unit, and then there are a slew of portable units available. So there's an example of a portable unit. Here's an in-duct example, and this is an extreme close-up of one of those wall-hung units. So what's the best system for you? It depends on your specific equipment and situation. In my opinion, the most bang for your buck is in the cooling coil section of your air handling equipment, assuming you have enough room for the installation. So with that location, you're keeping the cooling coil clean and running most efficiently, and you're getting the added benefit of treating the air as it passes through that section. So the duration time on this is limited because the air is moving at a pretty good clip through the air handling equipment, and the intensity is high though based on the close proximity to the UV source. Cost of this installation, a good rule of thumb, is about 50 cents per CFM for duct and air handling unit mounted UV systems. The bulbs are essentially the same as classic fluorescent tube lights and are typically rated for about 10,000 hours, so about a full year running 24/7 before they're degraded beyond effective range. Typically, the replacement bulbs run in the $10 to $20 range, depending on the length and the style and whatnot. And it's recommended that using the highest practical MERV filter in conjunction with the UV light is recommended, with a MERV 8 as an absolute minimum. The in-room wall-mounted UVs, they have the potential for the greatest contact time, but not great intensity. They run about $1,000 a unit with an effective maximum range of a couple hundred square feet. They're not the most aesthetically pleasing unit, in my opinion, but if your space isn't served by a central air handling unit, it could be a solution for you. And then finally, the portable units. The cost range from anywhere from $50 for a handheld device into the thousands for whole room units with remote. UV light it's only as good as a disinfectant for the surfaces that it'll see in this light. So there's a lot of potential for shadows from stuff in the room. So as you can imagine, if this guy's running around in the room, it's only the areas that the light touches is going to potentially get disinfected. So that, and combined with the multiple minutes of contact time, basically going back to that dosage we talked about, required for disinfection, makes this the least recommended solution. Increasing building ventilation, it's recommended. Outside air in combination with properly designed air distribution patterns, it's proven to be a disease control strategy for dilution of the room air. However, it comes with a caveat. It's unclear how much dilution or how much outside air is required to achieve a measurable reduction in disease. So basically, hey, we know it works, but we don't know how much air you really need to bring in to be most effective as compared to the increased costs that you're going to see. So as a mechanical engineer, I'd recommend, I would size equipment based on historical summer and winter weather data at the amount of outside air required being based on the mechanical code. So no, there's some spare capacity in the units I propose in the design. Most HVAC systems designed are not designed to see these large increases. So I recommend being very methodical about the changes to your outside air damper positions in your central equipment. Keep an eye out for extreme or extended abnormally hot or humid conditions, and don't hesitate to return the original damper positions. It's recommended you modify your HVAC equipment schedules to increase the occupied periods, operate in economizer mode. What is that? So when outdoor air conditions are favorable, a majority of the air handling equipment has the capability of bringing in 100% outside air. So that's known as economizer mode. I don't know where you are right now, but in beautiful Binghamton, New York, it's around 70 degrees with low humidity. It's a perfect day for that economizer feature to be running. Regarding demand control ventilation, this is basically a way to, as your occupancy in a given space is reduced, this would decrease the airflow accordingly. It's recommended that during the pandemic to disable demand control ventilation and bring the outside air that would normally be required during full occupancy of your building. As far as temperature and humidity levels go, I recommend keeping your typical ranges, 68 to 75 degrees with a 30 to 60% relative humidity. So these are all great strategies, and but you might be thinking, Chris, these are great, but employments are down, and I don't have any money to spend in these improvements. So if that's what you're thinking, the next couple of slides are hopefully for you. So I strongly recommend conducting a field review of all your centralized HVAC equipment to make sure it's operating properly. If you've ever heard commissioning or retro commissioning, this is essentially what it is. It's a systematic review of your HVAC equipment to ensure it's functioning as the design intended. Basically, your best investment is making sure the money you've already spent on this equipment isn't going to waste and your equipment's working to the best of its ability. It's relatively inexpensive. It can be performed by your maintenance staff or your preferred engineering consultant. Make sure your outside air dampers are open. Dampers or actuators can be loose or fail, and equipment schedules get adjusted or overridden. And you'd be surprised at how many times I've opened up an air handling unit to find the outside air dampers completely closed. As we talked about, update your HVAC filtration. Make sure your air handling systems are providing adequate airflow. There are no blockages, for example, a closed fire damper or smoke damper. Check your outside air intake regularly for potential risks such as exhaust nearby or proper clearance if accessible by passengers. And for your building automation system, check that the zone and air temperature and sensors are calibrated accordingly, and make sure that your occupied, unoccupied schedules haven't been overridden. I've seen happen is for whatever reason, maybe it's an extended cold streak or some nuisance fumes being drawn into the unit. Someone at some point has closed a damper or overrode a schedule. It's been like that for months on end. So this photo right here, very briefly, this isn't just a stock photo. This is one I took personally during one of my commissioning runs. As you can see, these filters, while they are in the unit, they're not exactly doing a great job of filtering the air in that space. So another area that could be improved upon today is how passengers and staff are wearing their masks. I get it, no one wants to be the mask police, but this basic precaution has demonstrated benefits in reducing transmission. So we want to encourage our staff and traveling public to wear their masks properly. Classic violator I see all the time is the sniffer. The problem with the sniffer is that it turns out that your nose, in fact, is part of your respiratory system. And it's the equivalent of having your air handling equipment filter bank only half full. So I've personally been caught by my wife of being guilty of the earring. I think it's a good look, and clearly I'm a trendsetter here. I mean, look how happy this guy is. He knows he's being fashion forward. So kidding aside, we have a mask policy in place, so let's get the most benefit out of it by wearing it properly. So in conclusion, we want to make the most out of our existing equipment. While it has capacity limitations based on traditional sizing criteria, let's ensure functionality of the equipment. It's going to provide a healthier environment for our passengers and airport staff. With increased ventilation, keep an eye on those space temperatures and humidity levels, and use your building automation system to capture trending data for future analysis. Operating costs will increase. There's no getting around this, and majority of the strategies we talked about will increase operating and maintenance budgets. So we've all heard the saying, if it sounds too good to be true, there will be opportunists out there that will try to sell their products. Proven to be 99.99% effective at killing COVID-19, or you may just have more well-meaning people who offer up other technologies not discussed today, perhaps not as well vetted in independent tests. Just please take your time, do your research before investing large amounts of money into any given product that will cure all the ails you're building. create a marketing plan. You can pretty much implement all the strategies we covered today, and you know what? Your building will look completely the same to your passengers and staff. So if you're going to make this investment of time and money into creating a healthier building experience for your passengers, sing it from the mountaintops and let them know about it through a marketing plan. Use your webpage, social media, traditional marketing methods, and post it throughout your terminal. People want to feel safe. They want to know you care about the cleanliness of their airport experience. So along those same lines, while most airports now implementing increased levels of cleaning, don't be shy about having the cleaning crew working during your busiest times at the airport. You're making this investment in increased cleaning. Show it off to your passenger base to make them feel safer. So let's also use this as an opportunity to plan for the future based on equipment performance and trending data you're collecting and the knowledge we'll gain from this experience. Consider creating a dedicated HVAC equipment sequence of operations for future pandemics, heaven forbid, or a particularly bad flu season. So, and finally, this too shall pass. Things are pretty bad right now for a lot of people, but history has taught us that this will end and we'll get to the other side of this thing. So please stay strong, keep the faith. Consider using this as an opportunity now to create a healthier building for your returning passengers. So with that, I wanted to say thank you to all the members of the Northeast chapter for allowing me to present to you today, along with the moderators and my fellow presenters, Lisa and Jonathan. Hopefully I provided some useful information to you today. And with that, I'm happy to turn things over to Jonathan.
Thank you very much, Chris. Let's see if I can get this screen to share. Hopefully that's sharing now. So thank you very much. So what I would like to do here is take a little bit of time to look forward ahead over the next 6 months to a year. What are the things that we're going to be facing, and really focus on the passenger? I mean, let's face it, we need passengers. All of our airports need passengers. So what are the things we can do to improve those passenger levels? There we go. Okay, so what we're really talking about here in terms of these steps that we're talking about taking, and both Lisa and Chris have said, is to improve confidence in terms of these passengers. And it does very much affect both the confidence levels as to what we're doing, but also that we are, as Chris mentioned, that we're marketing and we're talking about those things and putting it out there. And if we do these things in collaboration with the airlines and with the governmental partners, we'll at least be doing our part in order to try and improve the number of passengers that are coming back to the airport and actually have that happen more quickly than otherwise it might not if we weren't. And in our research, we really see 5 key areas that we want to focus on with any of the implementation methods that are being talked about. First of all, it's got to be legitimate. We can't be doing window dressing because we lose credibility. We'll lose our passenger credibility and we'll lose passengers. 2, visible. You know, Chris mentioned, let's have the night cleaning crew be the day cleaning crew. The more that people see these steps, the more confidence they're going to have. The third is to be adaptable. And Chris mentioned this about not over-investing in the issue of the moment, because we are learning more about this pandemic as it proceeds. And we need to be able to adapt over the coming time as events or information changes. Fourth is to coordinate with the other aspects of the overall airport experience. That includes the airlines, includes the governmental agencies, TSA, even the ground transportation systems, because passengers really see this entire journey as their experience. It's not just one piece. And what we do, it's only going to be strong as the weakest link in the chain. And then lastly, we really need to focus on what's viable. With capital programs and budgets where they are, we need to be thinking about what can we do that is realistic and not be completely pie in the sky. Now, to date, the focus has really been on the top 4 methods in terms of mitigation and improving that passenger confidence. And there are a series of other in the near future, and by near future, I mean in the coming months, that are actually going to be more and more prevalent in a number of airports and actually being piloted that we're going to get into in a moment so we can sort of see where things are headed. So let's start with past being prologue. Most of you are familiar with this chart or a version of it, and it's incredibly awful, but it does tell us sort of where we've been and perhaps where we're going. The orange line being the passenger levels through national TSA checkpoints as of 2019, from the period of March 1st through to just a couple of days ago. And the blue line, unfortunately, being what we have been experiencing. And we really see this pandemic playing out, especially for the aviation industry, in 4 phases. The first phase we've been through. That's the April into May phase, where essentially the entire country was in lockdown. Passenger levels went down to approximately 4 or 5% of what they were in 2019. That is pretty much behind us. We do believe that we're going to be running into isolated lockdowns, but as a national level, we think we've moved beyond that. And we currently find ourselves in the second phase. And in this phase, as Chris had mentioned, and also Lisa, the transmission of the virus through aerosol, through the air, is becoming more and more of an issue. And so the biggest method that is being utilized and can be done is this idea of distancing. Let's just keep apart from each other, the 6-foot social distancing. This is something that has been pretty effective, that a lot of airports actually have been pushing, and through the marketing programs, through signage, et cetera. And since that low point in April, we have been nationally seeing an uptick in the passenger loads, getting us up now nationally to about 25 to 29% of the 2019 levels. Now here in the Northeast, we've actually seen it a little differently than this. Our increase was a little bit higher, and we've had more of a drop-off recently due to primarily some of the governmental quarantine criteria locally. But generally speaking, we're in that 20 to 30% range. And it actually turns out that that's a really important number that we need to think about as we look to what are we going to have to do over the next few months. And why is that? When we think about our terminal buildings, they are designed to accommodate a certain number of square feet per passenger. And when we look at, let's say, a typical hold room or a ticket lobby, that's generally that 15 square foot per person sizing. Now, when we incorporate social distancing, you'll see that it's actually 50 square feet per person if we were going to have a social distance model. And what that essentially translates to is that our terminals, based on the way that they've been designed, if we have to social distance for a long period of time going forward, they really can only accommodate about 22, 25, 30% of the passenger load. And that is where we are right now. So in aggregate, again, every airport being different, but in aggregate, we are finding ourselves right now today at a very important inflection point. That in order for passenger levels to go up, and for those passengers to feel comfortable in distance while we have more passengers moving up, we have to do something different, whether it be physical or whether it be operational. This is a very, very important moment right now and going into the future. So the issue, of course, is that phase 4, when a new vaccine has been widely implemented and people are comfortable and we can get those passengers levels back up approaching 2019, we have this gap. We have this gap right now, and we don't know how long that gap is going to be. In terms of a vaccine being widely implemented, probably like all of you, I've heard everything from a few months to a minimum of a year. And so it is in this period of time that we see there's an opportunity. There's an opportunity for all of us to look at what can we do to essentially allow us to increase passenger loads while still keeping passengers comfortable and safe via social distancing. How do we do that? That's our big paradox. How do we increase passengers, still having social distancing, but without building any more space? Because from a capital budget standpoint, we just don't have it. We need to literally provide more space in the same space in order to get these passenger levels up and everyone to be comfortable coming to the airport and flying. And that's really the challenge that is facing us over this next 6 to 12 month period until the vaccine is fully implemented. So we have a couple of case studies of a few airports that have gotten really creative in how to do this, how to provide more space in the same space. And we think that looking at some of these, there's a couple of key things to keep in mind that can help guide all of the airports here at the conference and thinking about their own airports and what opportunities there might be. So the first is, and Chris, you touched on this, is to not get caught up in the issue of the moment, but to think about what type of an investment would be valuable both right now for the COVID situation we have, but it's also a value in the future, right? So what's a problem that existed pre-COVID that we can address through what we do right now, and it doesn't become sunk money, something that you have to completely undo. The next item is very important, and it's coming through some of the social scientists that are beginning to discuss this issue. We are all getting very, very used to having more space between us. We're getting conditioned to expect to have more space between us, not just at airports. It's at the grocery store, it's on the sidewalk. Everywhere we're expecting to have more space to be comfortable. This is going to continue in the mindset of passengers beyond the vaccine. passengers are going to expect a little bit more elbow room. And so we need to be thinking about how can we help passengers have that positive feeling post-vaccine to have a good passenger experience, because that's what we want to do. Next, we want to focus on, well, where are the high value investments really? Where are they? And this is where we're really focusing on this idea of reducing crowding and reducing density of passengers. And there's a few ways that that can be done. The first, of course, is just to build more space. Now, there's very few airports that are in a position to do that. Those that are, in order to provide more elbow room for passengers in public spaces, it is eligible under the CARES Act for funding. So it's something to consider if you're one of the few airports that actually has that possibility. The next is probably the most common thing for most airports, and that is to look at the existing space you have and how can we use it differently? How can we be more flexible? How can an area that is usually just for concessions, maybe partly for concessions, but also partly for a hold room, as an example? And then the last is technology. There is a number of new technologies that are coming out that are looking to manage crowd usage in order to reduce the surges and the gaps in crowds that often occur at airports. And we'll get into that in a little bit. Then the last thing is really focusing on where the highest value is. You know, Chris, you mentioned the hold room, and that is a very high value area because a lot of passengers are going to be dwelling there. And really we see the high value areas to look at potential investments are hold rooms, checkpoint, and your ticketing lobby, because that's where you're getting the major gatherings. Restrooms are also one of those areas. And I do want to do a shout out to Bradley Airport, who we work with and just got actually some national recognition for their completely touchless restrooms. McFarland Johnson was part of that project as well. And so if you're interested in looking at how touchless restrooms might be implemented, friends at Bradley Airport actually are a fantastic resource for everyone here. So let's look at a couple of case studies about how airports got really creative without building a whole bunch more space to make passengers more comfortable, give them more social distance, and accommodate a larger number of passengers. So this is an airport in the Northeast region. It's a smaller regional airport. So it has a single secure hold room in the upper right-hand corner there in yellow, as a single checkpoint and in orange. And the hold room works great pre-COVID. It could accommodate 138 passengers in there, no problem. But when we apply the social distancing of 6 feet, that number actually reduces all the way down to 40. Now, we don't want to overcrowd the hold room because that's going to make passengers uncomfortable and they're not going to want to fly again. So what can we do? Well, this airport got really, really creative, I thought. Across from the checkpoint, pre-security in blue, is a concession seating area. Now that concession is not active right now because of the because of the passenger levels are so low, but it's there. How could we use that differently? So what actually has been worked out in close coordination with the primary airline that uses the hold room as well as the TSA and the airport is to essentially fill the hold room to the 40 number of people. But at that point, the checkpoint actually would pause. And as passengers continue to come, they would actually be held in the concession area as essentially a pre-security hold room. Then as the airplane begins to board and the number of people inside of the secure hold room start to reduce, the checkpoint sort of opens up. It acts as a valve in order to now allow people to move through. It was a really creative way to think about how to increase the size of your hold room without increasing the size of your hold room. And it was really actually exciting to see all those different agencies really get on board with trying to get creative this way. So that was I thought a pretty clever way to look at this. Another way to look at this is just thinking about how much space is being used by people walking around. So this is an airport that has 2 gates that are ground level boarding. And when they have both gates as arrivals and departures, you can see by the green arrows for the arrivals, there's a lot of space that's needed for people moving around. And it really breaks up the hold room and it reduces the capacity. So what they did instead, and they actually did this right off the bat back in May, is they actually designated one of the gates as arrivals only and the other as departures only. It was a really simple thing to do. They didn't have to do any new infrastructure, but because they did that, they completely changed the efficiency of the hold room itself. Could fit much more passengers in there while still social distancing. So again, pretty clever. The next area to focus on is the checkpoint. So the checkpoint is actually one of the most difficult areas to address as it becomes with social distancing because of the zigzag nature of the lines. Lisa, you had mentioned if someone in front of you is 6 feet away, that's great. But if the person next to you is 6 inches away, you're not really solving the problem, right? So the checkpoint queue lines become a very important area. Now at this location here at this airport, and this is really true of many airports, the exit lane is right next to the checkpoint. So we have a lot of space that is dedicated to arriving and departing passengers just passing by each other, just moving around. Is there another way that we can use that space? And in this location here at this airport, they actually, in the bottom right-hand corner, they had another way to basically exit the hold room areas and get to baggage claim. And so what they did is they're looking at rerouting everybody and utilizing that as the exit. And you can see in the top there, all of the additional yellow. That's all now potentially available to be used as checkpoint queue. Again, just by rearranging how you move passengers within your terminal, they're able to open up a lot more space that can accommodate a lot more passengers while still social distancing. Lastly, sort of look at ticketing. This airport here, this is something that we're just sort of starting to look at, which is thinking about the ticket lobby and the curbside as a single unit. How can we leverage that space better? This airport here actually it has the opportunity, because there are curbside check-in baggage wells that haven't been used in years, because it's something that really sort of started to fade away as the kiosk and self-bag tag trend really started to take over. But here's an opportunity to really think about potentially reactivating those and having curbside check-in in addition to the actual ticket line. And what it does is it really massively expands the opportunity of your overall ticketing area to allow people to be separate. So let's sort of jump ahead. And what are the likely trends as we get into phase 4, the new normal? And they really what we're seeing is they're focusing around 2 distinct areas. The first area is this idea of queue and crowd management. So think Disney. When you go to Disney, basically you have an appointment on your phone as to where to go to what ride when. And the idea of that is to, instead of having everyone crush one ride and have a line that's a mile long, actually everyone gets dispersed at the appropriate times based on where things need to be. That type of technology actually is being beta tested overseas in particular for airports, where you have an appointment for when you go to check-in, when you go to the checkpoint, when you actually board, rather than just everyone rushing to the checkpoint because they're afraid they're going to miss their flight. Lots of people in line that don't need to be in line that early. They could be in line later and reduce the lines, therefore reduce the population, therefore allow to have more social distancing within the same space area. So that's something to keep an eye on. And on this, I did want to mention that Massport actually is doing something interesting to keep an eye on. And that is that they have actually issued an RFP for new technologies, new companies that have innovative technologies for this type of crowd management to actually beta test and submit proposals to do a pilot program at the Massport facilities to see if they work and what works well and what doesn't work as well. So that's something to keep an eye on. They just started that. And I thought it was really, really interesting way to use sort of half-empty terminals right now to try and accelerate a new technology that solves a problem not just now, but also in the long-term future with regards to overcrowding at checkpoints. The other area that we see a lot of focus that is really being put into hyperdrive is the biometric touchless interactions. Probably read a lot about these. They're definitely coming. And in the thing to keep in mind on the biometrics is that both in the ticket lobby with biometric self-bag tagging and also at biometric boarding, which we've actually done some work with a major airline on, they actually take up more space. They do move people through faster, but they actually take up more physical space. So as this technology starts to come on board, you sort of want to begin thinking about your current ticket lobby and your current hold rooms and how these larger interaction systems would be accommodated within the space that you have. So what we're basically trying to recommend here is to take the entire passenger journey from the very, very beginning at the parking garage, dropped off at the curb, all the way through to the aircraft along the top here of the slide. And then as they arrive, hit the restrooms, which is the first thing they do, and then actually leave the airport, is to think about the measures that can be taken specific to each individual airport, both in the current situation, this new opportunity phase between now and when a vaccine is available, which is probably somewhere months to a year. And then what's going to happen even thereafter, these new technologies that are starting to get into hyperdrive. And really to put together a plan, almost like a sort of a map like this, as to how, as your airport, you can see these things being implemented over time to make as positive a passenger journey as possible, both in the short term and in the long term, and making sure that those investments short term pay off for you in the long term as well. Thank you very much. And I think with that, Laura, I should hand it over to you.
Great. Thank you so much, Jonathan. I will actually hand it over to Carl Burley.
Thank you very much. Outstanding. All three, great work. At this point, the presenters could look in the chat. There's several questions here to be addressed. I can either read them to you, or if the moderators, Paul and Susan, either way, we can read them out loud and see if we can answer these questions. So one question that has come up, and I'll ask right away, is, are the presenters willing to allow us to share this recording to the registrant, those that are attending? Are you all, it's your information, but are you okay if we share it, this recording with the presenters?
Yes.
Awesome. Thank you very much. So question, what credentials should airports look for when looking for a third-party consultant? So airports are going out to bid to get help in meeting these new normals. What credentials should we be asking for?
From the standpoint of infection control and cleaning oversight and making sure that your environmental health and safety plan and requirements of OSHA and CDC are met, I would say you're going to want to look for somebody with a history of infection control experience. Obviously, COVID experience is relatively new for most of us, but certified industrial hygienist, that's a pretty good moniker to be looking for, as well as reviewing the resumes and corporate bios of those firms. Do they have experience in infection control? And I'll let the guys next to me talk about the mechanical engineering.
Yeah, from a mechanical engineering perspective, ASHRAE does offer certifications in building commissioning. So if you have a third-party commissioning agent come in, you'll want to make sure that they do have those certifications through ASHRAE. And otherwise, your preferred consulting engineer would be just fine.
Excellent. Thank you. Next question is from Melinda, who said, I see some airports are installing or placing air sterilizers around their terminals. Are they effective?
I'll jump in on this one too. I would say that if your airport has central air handling equipment, you're going to get the most bang for your buck, in my professional opinion, by looking into a solution for that central air handling equipment, as opposed to these the portable ones, or they're in a lot of sense they're similar to those in-room UVs that I was talking about. You know, you have an effective area of a couple hundred square feet at best, and you know, if we're dropping $500 to $1,000 a piece on these type of things, your money long term is going to be better spent with a centralized solution.
Yeah, I would agree with that. I mean, we're advising clients the same. It's sort of, I think Jonathan touched on, there's a lot of people taking advantage of, you know, the opportunity to make some sales, or some snake oil salespeople. Same with some cleaning supplies. People make sure it's FDA registered if you're using a cleaning product. But those are really useful in a hospital situation where you've got a very controlled environment and you're trying to just sterilize a specific tight area. But placing them in a bigger environment, they're not very useful.
Okay. Next question from Darren. Darren Large, in reference to positive pressure versus negative pressure, is there the ability to change the setting on existing HVAC units to get the desired pressure in a space, or does it require new equipment?
So Darren, that depends on the size and type of your central air handling equipment. If it just has one fan inside the unit, you're going to have a tougher time with it than if you have dedicated supply fan and return fan. If you have a dedicated supply fan and return fan within the same unit, you could get a contractor there to balance the unit to draw more from that return fan than on the supply. So in theory, you could take care of it using that methodology. Otherwise, it would require the installation of dedicated exhaust.
All right, Chris, while you're still there, maybe you can answer this. Will winter heating operation increase exposure compared to cooling where outside air is more often introduced at night?
Yeah, so your outside air shouldn't change between cooling mode and winter mode. There is some evidence, and I don't know if Lisa could jump in on this too, with regard to the virus's ability to withstand certain temperatures or humidity levels. I would be more concerned about going into the traditional fall flu season. That's going to have a much greater impact than, you know, slight modifications of temperature or humidity, in my opinion.
Yeah, I would agree with that. I mean, that's what we're seeing. Of course, you know, new things pop up every day as we go through this pandemic.
Okay, great. Question from Eugene Bolanowski. There's already reports beginning to circulate indicating that some areas are seeing herd immunity, COVID-19. Is it cost effective to look at these building modifications if we are beginning to see herd immunity developing?
Well, I guess that poses are we seeing herd immunity, and what is the public perception of that? You know, as somebody who's operating an airport and trying to get people back, you're not only dealing with scientific facts, but also public perception. And so is the public at large ready to say, yes, I'm fully on board and I'm ready to go with herd immunity? It kind of goes back to, are there things that you could be doing better? I think Chris gave really good, you know, stuff you can do now, low hanging fruit, and just share. That's going to make your operation better.
Yeah, so I'll jump on that too. Thank you, Lisa. So a number of the items that I talked about, increasing outside air, modification of occupancy schedules, increasing filtration. These are not large investments up front, and frankly, all of them can be reversed. You know, we fast forward 2 years, and we have a vaccine for this. We can go back to what our pre-COVID outside air levels were. We could go back to lower filtration rates if we wanted to. So I really tried to focus on a number of technologies that were or strategies that were completely reversible. So, because, you know, understanding that capital investment budgets are tight.
Excellent. All right, next question was for Lisa. Where can we find training? Where can airports find training for HVAC technicians or for those in charge of sanitation and disinfecting?
So on the sanitation, disinfection, and OSHA compliance standpoint, my firm offers training. Other firms offer training. There is a wide array of training online. I would strongly suggest a train the trainer sort of program. We've developed training for some of our clients that have been specific to them. In particular, training for hospital systems that are going back and forth through waves of pandemic to train their management teams. And the training that we've developed specific to them is resident on their server, and it's pretty cost effective. So as employees, you know, leave or come back, they can go ahead and take that training session, which has knowledge review, and then the trainer, making sure you have well-educated, trained management to oversee your staff on the cleaning and the environmental health and safety side is important. I'll let Chris or Jonathon answer the HVAC question.
Yeah, I'm good on my side. Jonathon, if you want to jump in.
I think, Lisa, you summarized that well.
Okay.
All right, next question up from Darren. Have you had any discussions or research on snow removal operations allow employees to conduct snow fighting in a safe, efficient manner? And I think what Darren's alluding to is sharing of equipment, close proximity into cafeterias and day rooms, and just the whole aspect of snow fighting. You're in close proximity with coworkers.
I would look closely to the construction industry. to see what they're doing as well. I mean, they have already, they've been considered essential business. They're continuing to work, and there's lessons learned to be gained by how they're working. They're doing things in proximity now. They're wearing masks. Even my firm as engineers, we have people doing work in the field, and they're traveling to the field in a vehicle, masked, however. We're doing questionnaires in advance of working, and then we're asking them when they are in the field, where possible and practicable, to remain that socially distanced as they can. But it is true that there are construction activities, there's different activities that are going to be very difficult to socially distance. And so looking at those areas that have already been doing it for a while and the lessons learned will really be helpful.
I could jump in on that as well. I agree, Lisa, the construction industry has been a major focus of that area. And one of the things that we've seen as probably hard to do, but maybe most important to do, is contact tracing. And very, very detailed records as to who is where and when. And so as an airport, and especially when you're running an SRE operation, really requiring everyone to sign in as to exactly when they're there, where they are, at what point, and who they're with. Because, you know, an issue of one person getting sick, that's one thing, but what we really want to avoid is these sort of really large outbreaks, because we're not able to contact trace and then act and isolate in a quick manner.
That's a really good point. So contact tracing has been a requirement of a number of our industrial clients on the industrial side as well as the construction side. And so signing in, signing out, using electronic keypads, or even entry to buildings where you have it, if you have a key fob and somebody has to use a key fob to enter a building, all of those things can help with contact tracing, as well as regular questionnaires. We have a number of clients that are employing those, because it becomes more critical when you have a lot of employees and they're working together closely.
Great. A couple more questions, if you don't mind. Melinda Montgomery is asking two questions. What should custodial staff wear to perform duties related to clothing or removal? And what about cleaning chemical burns that I hear are affecting some patrons? What ingredients should we look for? What should we avoid?
Yeah, so performing cleaning duties, essentially gloves, coveralls, and masks as appropriate, and really look at those chemicals and see what's required. You should have the safety data sheets for any chemical you're using. You really shouldn't need to be using harsh chemicals to clean. Chemical burns, I would hope you're not, if you're using harsh chemicals, it's really unnecessary. There are many cleaning solutions out there that are FDA approved, EPA approved, and effective in coronavirus cleaning and inactivation. So look at the list. It's on the EPA website, and it's linked from CDC. That list also contains the recommended PPE for each particular chemical. And so that becomes an element of training, looking at the SDS and making sure that people know what protective equipment they should be wearing while they're conducting the activity.
Great. Might be the final question. Are airports and airlines coordinating or working well together as far as enhancing social distancing? And also the state of New York is asking those who are flying what seat they're sitting in on a plane as part of their contact tracing programs. Are the airlines coordinating? Do you see the airlines coordinating with the airports?
Because I could jump in on that or start it off. What we are seeing a very wide disparity between what any individual airline is doing and in some cases what various airports are doing in their coordination. And we're also seeing airlines change their own internal policies relatively often recently. And so, I think that coordination issue is a real challenge that as an industry we need to get better at, because again, the passengers will just see the weakest link in the chain. So I'm interested if any of the other airport executives themselves have seen a high level of cooperation and communication with the various airlines they serve. But I know in my experience, it's been a mixed bag so far.
Very good. One more question came in from Natalie Pavlok. Is it recommended to have PPE such as masks available to give to passengers if they come with ineffective masks such as bandanas or some sort of face covering better than none?
Recently flew from San Diego to Salt Lake City, and I was wearing an appropriate mask, but the airline handed out to people that did have bandanas. They asked them to please wear a mask. So I thought that was interesting. It's just an observation. I thought it was a nice touch. Being a passenger myself, that's just from a consumer standpoint. I definitely appreciated it.
Very good. I believe that is all the questions. I can turn this back to Paul or Susan if you have any final comments as moderators.
I just want to thank everyone for participating. I hope we approached it in the right way. We didn't want to get super technical. Just wanted to provide some information. And again, I think people are available to reach out to later if you want further information. I think there was reference to taping this. Yeah, we will be making it available at some point, and Carl will handle that. It'll be showing up on the website, and we appreciate everyone participating today. Thank you.
Well, thank you.
And the chapter thanks all of you. Chris, Lisa, Jonathan, outstanding presentation today. The amount of information that you presented in 90 minutes is unbelievable. Susan and Paul, outstanding work putting this together, coming up with such great presenters. Thanks again. Thanks for being part of the conference committee. I just want to remind everyone.
Can I hop in real quick? Just getting a couple questions, private messages. For those of you looking for CEU credits, you will need to self-certify, but if you need a certificate or letter from the chapter showing your attendance, we do have the Zoom logins here, so we can confirm your attendance here, but you will need to self-certify your CEUs.
Excellent, thank you. Any others, Zach? Great. So again, huge shout out to today's sponsor, CNS. The sponsorships have been those of you that are sponsoring sessions and McFarland, Johnson, the lobby, and it was just completely reached into your pockets to help us out with the chapter to get this conference moving and afloat. We can't say thank you enough. I do want to remind everyone that session 3 is next Tuesday, August 25th. Another great session coming up. It starts at 11:30 on the 25th. Is an FAA update with Kurt Schaefer. Kurt Schaefer is the FAA Associated Administrator for airports, and Alex Gertson will be moderating that for us. With that, if I haven't forgotten anyone or anything, I just want to say thank you again and hope to see you all on Tuesday. And have a safe afternoon and safe day. Thank you. Great seeing you.
Thanks, everyone.
I know. Nice scarf. It's awesome. Good stuff. Bye now.
Awesome job, Carl.
Thank you all.
Great session.
Thank you, Jill. It's
Great job, Lisa.
Great stuff.
Thank you.
Thanks, Carl.
Bye now. See you all.
100%, Carl. Great job. Thank you.
Thank you,
Good
Jill.
job.
Awesome job, Jonathan.
Real good stuff. Darren, great questions. All good things. Bye now.
Bye-bye.